Right, good morning. Good morning. I'm Bipin Thomas. I'm from Peoria, Illinois, just about a couple hours south of Chicago. Pleased to be here. Very, very different topic of interest to you all. So I wanted to give a little bit background about Global Virus Network. I represent Global Virus Network. It's headquartered in Maryland, in Baltimore, Maryland. And it was founded by Dr. Robert Gallo. I'm sure all of you know Dr. Gallo. He's the inventor of the human heterovirus. And he's also the head of Institute of Human Virology at the University of Maryland. So I'm part of his group. It's a nonprofit organization set up with a team of leading virologists, scientists, researchers around the world. And what they do is they are facilitating research and education and becoming a support to the continuum of care in delivering care for various virus pandemic around the world. So I'm helping them drive that goal with the businesses around the world because, as we know, global corporations around the world are in need of making sure their workers and the communities they operate in are protected from viruses. So we're helping large corporations like Caterpillar, ArcelorMittal with a global footprint in managing their workforce population. And if there is a virus breakouts, how do we help and drive the right education, bring the right scientists and virologists and researchers down there, and also the care delivery platform for them so that the businesses can help contain the spread of the viruses. You know, just like the Ebola that we all went through. A lot of the businesses got really hit from their bottom line perspective. So they're taking more and more interest these days to work with these type of organizations to help prevent the viruses and control them and monitor them. So that's part of the organization that I belong to. What you see today is the technology side of it. You know, what are some of the technology solutions that are put in place that are working with the Global Virus Network in helping the communities, the businesses, and also the researchers and clinical trials in expediting the virus programs, the scientific programs that are out there. So mainly my focus is today to give you an outline of what are those technologies and the solutions that are there and that's working. And two, how do you monitor these patients or individuals who has been going through some of these virus-related diseases or chronic conditions at home and keep them at home so they're isolated, but yet monitor using technology. And I'm sure you're familiar with telemedicine, but we are going a little bit further than telemedicine by deploying devices, technologies that are wireless and capable of sending some data, wireless data, to a central facility to monitor them so they don't have to be moving around the community or going to a hospital and getting more infection out there. They can be isolated at home and treated at home and monitored at home. So those are the two parts. And then obviously this is also relevant for clinical trials. As the new drug discovery programs are out there, this can help in putting devices for clinical trials to enable that patient data, monitor data to come in for clinical trials of drug discovery programs. So those are three parts that I like to quickly take you through. So we've established a consumer-centric outcomes research program that are technology-driven. And what we are looking for there is that the whole divide that we see between the consumer and the patient, as well as between the providers and the payers, because we feel there's need for solutions that can help bridge that differences between the two entities. And we have a team of physicians, nurses, researchers, quite a group of technologists that are embraced with the team of physicians and nurses. We are also specialized in the high-tech plus, the high-touch team because we felt technology cannot do everything. So we want to make sure that they're embraced with nurses and physicians, staff to drive this effort. And this is the profile that we are building. And I think for the team here, the interest would be the virome profile here. Because as you know, obviously, especially in the U.S., the claims and clinical data is being working together. There's collaboration, tight collaboration between these two entities. Between these two entities. And now you can see this is coming up, this is shaping, because telemetry is out there. There are devices that we can use to collect patient data. And now, of course, genome is something that everybody is trying to get their hands on, and they're bringing that data for understanding the individuals better. And microbiome, virome, and connectome are in the early stages, I would say, in terms of bringing and connecting that dots with the rest of the data that we are collecting. So that really gives a 360-degree view of an individual, a digitized view of an individual. And that's missing. That is missing in the world today. So what we're building is the full 360-degree view that connects you from all the way from claims, your clinical data, which is sitting in your EMR, to all the wearables and the bio data that you can collect. But what we are specializing, it's not the bio data that you get from your smartwatch or your Fitbit, but really getting the clinical data, medically graded data from your spirometer, from your oximeter, from your weighing scale. So getting that data and then blending it with your genomic data, with the microbiome, virome, and the connectome data. So really bringing those dots, connecting the dots together, and using a technology platform to collect the data for research purposes, and providing that data for access to top institutes, for drug discovery programs, for clinical trials, and also for understanding where and what type of issues are happening around the world. And this is the platform that I just was bringing up in the beginning of this conversation. And this is what we have put together. This is just a few devices you can see here, but it includes wireless thermometer, heart rate monitor, ECG monitor, several of the monitors that are around this, which can be used for on a deployment at home, patients at home. So in the US, as you can see, the services that used to happen within the walls of a hospital or a primary care physician is now going to home. So everything that used to happen inside that four walls is now replicated wherever you are, at home or on the go. So these technologies are now newly put together in order to move the patient monitoring systems from the hospital setting to where the individuals are. So this is the structure that we have put together, and we have now this running in Illinois. Multiple sites in Illinois is using it. The same system can be used for clinical trials. So as new vaccines and new programs, drug discovery programs are piloted by companies for new viral diseases and treatments, these kind of settings can be used for running clinical trial of the patient. So patients could be at home, yet send their daily readings. And we have systems that track their data and track their daily readings. And we started with, how we started is we started with some of the disease management pathways here in the US, CHF, COPD, and many of those. And this is the foundation that we used to develop the clinical trial programs for viral diseases. So we have now patients running with these kind of disease management pathways, especially here at sites in Illinois. Since I'm based here, I'm spending more time here in Illinois. So we're those sites up and running now. But this is the foundation that we used for developing the system for tracking viral diseases and also monitoring patients with viral diseases. So what does that do? I mean, it certainly helps with addressing unnecessary patient visits, readmissions, all of those things, but mainly for monitoring patients at home while they are at home, and controlling and taking that data from them so that the physicians and the nurses can act better. And here's a quick snapshot of how they do it. I mean, they would get enrolled in the platform, and then we would provide the instructions on what devices they should take home. In fact, some of these devices, I mean, the weighing scale and blood pressure are slightly larger, but a lot of the devices, like the thermometer and many others, are very small devices. It can be kitted in a small box and can be delivered to the patient's home so they can start sending the data, and using this dashboard and analytics to drive some of those individuals in managing their prescription adherence. So medication adherence is an important thing, so we can use that for sending data. And also devices that would provide patient education videos In fact, we have video clips from Patient Education Institute of Washington, D.C. That we have worked with to deliver those relevant videos to them during the time of clinical trials as well as for the treatment plans. And so this is what the platform does in a nutshell. Quite a number of features, as you can see, but we can pick and choose anything that is necessary for controlling patients with viral diseases and monitoring them at home, and for clinical trials of viral drugs. So we can certainly look at each and every aspect. They are all building blocks of it. And with Global Virus Network, we are piloting this at different parts. They just came from their annual conference in Beijing last month, in the month of May. And now we're looking at deploying this as a platform around the world, not just here in Illinois for some of the pilot facilities, which just started late last year, but we have the competency now to connect this, including the telemedicine. Even telemedicine is a great platform for this because there is a good interaction between the nurse and the patient being at home, that they can really talk to them, find out what's going on, what are the symptoms, and have a meaningful dialogue face-to-face using a telemedicine platform. We have a small 10-inch tablet, which is less than $100, so even if it gets ripped off, it's no big deal. So a small $100 tablet that we would give out to those patients, and that is a good way of communication. So they don't need to have any Wi-Fi infrastructure at home. They don't need to have a computer at home. They can just communicate easily with their provider back and forth. So those are the kind of tools that we have provided so that it makes it easier for the communication and the nurses to work with them and doesn't have to have the human touch. You can still be in contact with them, and they can be at home, resting at home, and being monitored from home. And this is the patient education videos that I talked about. So based off of the change in medications that you are providing, we can send the right videos at the right time. So they understand the purpose of that particular tablet or a dispense that you're providing, or a particular treatment plan that you're advising, or an adjustment to a dosage that you're giving. Then that particular can be provided on a real-time basis. So they get that information. They know what they should go through. Even some basic things like drinking plenty of fluids. In a congestive heart failure, having low-salt diet. So simple things like this, we kind of push those videos, and we found the patient engagement improved a lot. In fact, a lot of the population has told us that this is good. Now I'm informed more, rather than just at one-time discussion with my care provider, and then I'm on my own. Now there is a constant interaction. There's a constant engagement because the tools are giving me more information and data to understand and treat the things better. So it engages the patients even better, and that's the metrics that we are collecting, and we're seeing higher patient engagement because of that. And we're going a little bit further than this. That means the analytics, the power of data and the power of analytics, we are enhancing that to a next degree, for the hospitals to leverage that data, for the employers to leverage that data, for chronic disease management conditions to leverage data. So not just collecting and monitoring the patients, but we're taking a step further by running analytics on top of it so that can be used for many of these real-time predictive analysis, and for drug companies, to researchers, to vaccinate companies. So we're providing all this information throughout the healthcare ecosystem. So everybody benefits from it rather than one individual hosts the data. We're providing that bio data to everyone because that whole 360-degree view can be built together only if all the parts of the ecosystem works together, where it's the payer, the provider, the med device manufacturers, the pharmaceutical companies, the life sciences companies, the wellness companies. If everybody works together, then that data could be leveraged. So we're providing the data and the analytics across the healthcare ecosystem. And it is powered by, I'm sure, Watson. Everybody's aware of it. Watson beats Jeopardy. So Watson is now managing health. In fact, IBM has built a business unit. CEO Ginny Rometty said the healthcare is the next big frontier to conquer. So IBM is going at big time. I mean, Watson can tell you what vaccines are out there, what kind of treatment plans is working, where the diseases are being spread, which country, which location. Because it's constantly looking for data and massaging it, and then making insights, cognitive computing, making insights out of it. So we're feeding that data into the power of Watson. So it's also taking its own look at the data. So our job is to make sure that it is available. Data is available to everyone, so everybody can benefit from it. It's not just kept within our own databases. And of course, at the end, wrap it up with the surveys and ensure that the patient satisfaction improves. And that's very important because today, especially in the U.S., as you all know, the providers and the payers will get the bonuses and incentives only if the patient satisfaction goes up. If they go down, obviously they get penalized. CMS is very hard on them, Centers for Medicare and Medicaid in the U.S. So obviously patient education plays a big role. So it's not just that one-time contact with the patient in a treatment plan, but also as the patient goes home and manages treatment plan, how well the provider is engaged with them, how well the care delivery platforms is engaging them. I think that's a big part of the patient education survey. So patient surveys are key for ensuring the AAA metrics is met, which is patient satisfaction score, cost of care, and quality of care. So if those three metrics are maintained, then the providers make money, the payers make money, the patient is satisfied, the ecosystem works together. So this is a key part, and this can be done also remotely. They don't want us to be sending them paperwork or waiting for their visit to come to a doctor's office to fill all these things or a clinical trial to be completed and then filled. They can be done remotely now using the survey. So that's kind of a wrap-up. Our lab is in Peoria, like I said, at the Peoria Next Innovation Center, which is where a lot of the new compounds, life sciences companies are all incubated. It's like an incubation center. And we also have a digital care studio where you can experience all these tools and everything that I mentioned up downtown in Chicago. So that's kind of in a nutshell. Let me take a pause here and then answer any questions that you may have. Thank you.
Let me unmute your microphone. Okay, go ahead.
Are there any questions from the board?
Anyone like to ask any questions? Sir, here we go.
Yes, thank you. Is Watson being used for the analytics to help study the spread of disease and the incidence or is it to turn toward the patient after these various data have been received through the Bluetooth devices? It turns around and it alerts care providers if it sees troubling changes.
Good question. Right now we are using for analyzing the data. So right now we are using to analyze the data that we are collecting from the biometric information. So it's data that we are collecting from the devices. Watson is crunching it. Because then Watson can make much more meaningful sense because it's already seen your profile, your clinical history from EMR, your treatment plans, medication adherence, how many times you fell sick, what were the issues, was it viral or some other chronic condition, and how many times you've been hospitalized. So it does see all of that, and now getting this real-time info coming in, it can analyze it better. So right now that's the phase we are in. But having said that, Watson is capable of looking at the disease spread across the globe because it can chew in any vast amount of data sets, like even news feeds, even searches. If people are searching for flu symptoms and diagnosis on the web, like WebMD. WebMD is a place where now most of the people go to rather than Google search. And they have this data coming in, which Watson can get that data in and say, I'm seeing maybe there is a new phenomena happening in this part of the country or this part of the world. And it can sense that.
Mm-hmm. Many virus infections need only comfort care, so I like the fact that sick individuals don't have to go to hospital and pick up a hospital-acquired infection that's something else, so I like it.
Oh, yeah, exactly. And that's the power of this. I mean, they all need to be monitored. As long as they're monitored and they're keeping well with the treatment plans, that the daily check or every other day, and that gives them the comfort. In fact, most of the patients we ran through the trials, they said, just knowing that someone is watching my data gives me the relief. Even though I'm at home, just gives me the confidence that my provider is getting my data and someone is watching. And if there is an alert, they're going to call me and ask me what you're doing. Why is this day different? Right? That themselves, eases them. That calmness is there in their mind. And that's the biggest thing that I've noticed, that the patient's telling us directly that that's a huge relief for them. So that I agree with you. I mean, being at home and then someone watching over them and seeing the data real time gives that extra comfort.
So how to protect the data for the freely? I'm afraid the data perhaps distributed freely for the everybody perhaps, and how to protect the data for.
Sure. The data we're collecting is on a HIPAA compliant system, so it is HIPAA compliant, and the patients have to sign off if they need to share this data with any other providers other than the provider that are providing these kind of devices. So they are signing up with their medical group, saying that I'm going to share the data with you because they're obviously their primary care, right? But if that has to go beyond that, then the patients would sign off on it.
Oh, I see.
And without the patient consent, we cannot give. Patient can share. In fact, now the U.S. law allows them to put this mobile consent. So if the patient is willing to press the button and share it, they can. You don't have to wait for the provider to share it.
Are there any questions? Go ahead,
Perhaps
please.
to follow on to Dr. Noguchi, he's inquiring about the data encryption to prevent stealing of data.
Exactly, yeah. So two ways of data encryption. One is we follow the 128K, the SSL encryption, which is one of the highest one. And then we also follow the HIPAA compliant regulation for the entire infrastructure where the data is stored. So with that, the data which has been transmitted from the devices are encrypted. So between the point to the point where it is sent, it's encrypted. And at the data collection, it is HIPAA compliant, and that resides with your EMR. So if the patient has a EMR record at the medical group, it gets stored in the EMR system. So EMR system, obviously, we all believe in. It's a safe environment, and it is eventually stored there as an encrypted form.
One more question is, I think as you mentioned, like chronic infection through the patient education and clinical trials applicable for this. But I think it's depending on the clinical trial or chronic infection, and each disease, different disease, has the I think it's needs the different kind of information data from the patient. How do you exactly choose the correct which data is correct to that how do you do that?
So this platform that I showed you is a very configurable platform,
Right.
and we go by the physician's prescribed model. So if the physician says, I need to have certain parameters to be monitored. Let's say in a chronic condition, somebody with a COPD, they want to have a spirometer, right, to get the peak volume, peak flow volume. They want to get maybe a pulse ox, that you want to get your blood oxygenation rate, your heart pulse. So they decide which parameters are useful, and then we put the right devices based off of that treatment plan.
Oh, I see.
So it is customizable for each individual disease rather than a standard thing.